You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxie Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Brian Lobley, who is the CEO of Tango Healthcare. Welcome to the show, Brian.
Thanks for having me.
Thanks for joining me. So let's start off by telling our audience a little bit about your background and what you've been innovating these days.
Sounds great. So a long kind of healthcare veteran over 2 decades. I spent the better part of 20 years at the Blue Plan in Philadelphia, Independence Blue Cross. My most recent accountability there was Chief Operating Officer. So I had accountability for all of our lines of business, Medicare up through kind of really large customers, national account customers. Also had operations, technology, informatics. And about 10 years ago, I launched an innovation practice and helped co-launch our investment practice. So I kept that all throughout my tenure there. And then about 18 months ago, joined Tango. So decided to, try to do something a little bit innovative in the space and try to bring kind of the post-acute space into value-based care. So it's been a great healthcare journey so far.
So let's get kind of to the heart of it. What was it that really prompted you to leave, a traditional, more conventional healthcare business for a earlier stage healthcare services company?
It was probably a myriad of things. I love my time at IBC, still have dear friends there and very close to the team and try to help kind of at a different perch, I guess, now.
Sure.
But after 20 years, I think there was, just so many different aspects of, I'll call kind of this value-based phenomenon that, people were tackling.
Yeah.
And I just thought there was a unique opportunity to do it in kind of a more direct way. So in the payer space, you're somewhat indirect. You're kind of the ultimate intermediary. And I thought, let me take a shot at doing something that's really growth oriented. Still looking for something that we were going to be growing new members and growing the business. And then something, honestly, that stepped a little bit more on the national scene. So
Right.
for IBC, we were Philadelphia located and still they have great business here locally and some businesses that are across the country. But, I was looking for something that also got me into new geographies and see how healthcare differs from like the Mountain West to the Northeast. It's just so dramatically different. So it was an opportunity to learn a little bit still.
And how has that ride been so far?
It's been fun. Huge change, right? I kind of tell everyone going from corporate America essentially to, kind of a private equity backed kind of early stage growth company.
Yeah.
Different challenges, right? Different opportunities. We have a much smaller team. We're nimble, kind of probably like the necessary bureaucratic overlay isn't there. You just have a different world to kind of operate in. But it's also been fun because I've been able to, learn a lot, right? Just post-acute is a kind of a niche in healthcare, but it is a niche with a lot of nuances. So I feel like I'm learning a lot where maybe previously I'd been there so long, I kind of knew all the nooks and crannies, and I'm still opening a drawer now and being like, whoa, what's that doing in there? What do I do with that? So it's been fun.
Yeah. So tell us a little bit about Tango Healthcare and what problem you're solving for the market.
So we are a kind of a home health anchored business. So business has been around actually for over 20 years. And in Phoenix, Arizona is the headquarters.
Hardly a startup.
Actually, hardly a startup, but I'll say kind of in this new innovation pivot, right?
Yeah.
Post the Vistria Group, which private equity firm in Chicago, acquired the business in March of 2022. And really the business is doing really well in the Mountain West. So Arizona, New Mexico, Colorado, Nevada. And the hallmark of the company was actually a home health agency, and they were providing care. And what they realized is there was a challenge in really understanding what the post-acute needs of their members were. So it's like kind of this chase. They get to a home, kind of try to provide care, not get a lot of information initially, or really just struggle to staff, right? How do we get, a nurse there within 48 or 72 hours? So they actually kind of innovated pretty early and became a managed service organization. They started managing the referral. And they said, hey, we'll deprioritize our agency. We'll be a backstop. We'll start sending and staffing the referrals, but we'll improve kind of that matching process. That naturally led to, okay, what's kind of next, right? And the next journey is saying, how do we go value-based? How do we take kind of full risk? So when Vistria came in, their whole objective and investment thesis was, let's move post-acute to value-based, right? Primary care has gone there, acute care has gone there. It's not a lot has really gone there in post-acute. So that's our journey. We're trying to go kind of, we still do full risk. We're a capitated model. We don't own the docs. We network aggregate with the providers. The payers are our customers, but we focus on getting patients staffed. And then our full risk nature, we take accountability for reducing readmissions and reducing emergency room visits post-acute. So especially the senior population, if you're discharged, if you don't have a home health visit within the first 48 to 72 hours, your readmission rate in those first 7 to 10 days skyrockets. So we really focus on getting, a nurse staff to the house, seeing a patient, and then allowing them to do what they want to do, which is recover at home. So I think it's a unique model, and we're growing across the country now.
So what are your thoughts about value-based care? We've had some success stories, some not so success stories, kind of where, from your perspective, kind of like where we are as an industry around value-based care, what's working and what's not working, and why is it working for the business model for Tango?
Yeah, I love how you just phrased it. I mean, there are great success stories, and there are some just kind of epic things that didn't work. I don't want to say failures, because I think everything was a good idea, but just didn't work. Where I think we are, honestly, I still think we're in the early stages. And I think because what's unique about healthcare is we haven't fully embraced the team sport model, right? We still have all these like really big segments. So like big payers, big health systems, big provider groups, big specialty practices. And really, at the end of the day, everyone has the same objective. No one wants a patient to suffer. They want a patient to get quality care. They want a patient to recover. But then you look at that pie and you say, well, I want the whole pie. Right. So I think this notion of, hey, it's okay to give pieces out, really, you have to embrace this team sport mentality. So I think we're on that precipice of change. And what's great about kind of the I'll say the overarching kind of health system model is, from like west to east and south to the northeast. So when you get to the real big kind of population centers, I think there's now being that change to say, okay, hey, let's look what's working in California, where there's a lot of shared risk deals. That's moved into the Mountain West. That's moved into, certain areas of the country. So I think we're, maybe halfway through, or maybe a third through the book, right? Which like we haven't really kind of got to the fun part of the story yet. Like we're just about there, but I think it's got to happen. It's the only way I think healthcare, quite frankly, is really sustainable in this kind of private-public model that we have going on here.
What's interesting is that's kind of part of my story and my entree into healthcare. So I started, I was a chief marketing and communications officer for a group of entrepreneurs in the early 2000s. And it was my first stint in healthcare. It was 5 healthcare brands, and one of them that we built from scratch. That was a pay for performance business model around chronic neck and back pain. And this was before the Affordable Care Act. So it was really, really revolutionary, selling to some of the first ACOs in the country. And I mean, there was just so much excitement and enthusiasm for this shift. And because I hadn't been in healthcare and really understood the pace that in some of the intricacies of the industry, I mean, I thought for sure, in 3 years,
snap your fingers, ready to go,
transformed. And lo and behold, we're still, 2024 talking about value-based care. Not that it's a new thing, but, still new when it comes to true adoption. Yeah.
We are inherently slow as an industry. And I think because there's so much cost, right? There's, you go back to your questions on like, successes and failures. That leads to winners and losers, right? So this notion of like, how do I make sure I win? Look, I mean, we believe in business models, right? So I think everybody's got to win, but I think then it comes back to like what you learn on the playground at 2, 3, and 4 years old. Like, in order to win, you got to share, right? So I think we still got to grow up a little bit. But I really think again, you talk about like, it's been 2 decades, I guess, almost to that point you're using, like, it's, we're like a young adult, right? We got to get, more responsibility now. So hopefully that's the way.
We're just hitting puberty.
Yeah, exactly. Right. We're just figuring things out. Right.
Um, so I want to kind of peel back some of the layers of your story around your, blues experience and payer
Yep.
experience for, there's a lot of innovators in our audience that are trying to become a vendor that's selling to different Medicare Advantage programs and trying to innovate within the payer ecosystem. So, just kind of give us some insights on what your take on in what's happening in those kind of two areas, and what are some maybe best practices for innovators to kind of be able to penetrate into the market.
First, it's hard, so don't get discouraged. So I was a buyer for a number of years. We were very fortunate at IBC when I was there. We had a back-to-back five-star plan, $1 billion plus revenue business, 100,000 lives,
Which
and
is
we did
amazing.
well.
Yeah.
Thank you. I thought I thought I could retire on that, but here I am still working. But I think what you have to find is you have to search for good buyers, right? And usually good buyers really means you gotta find who can say the yes. And my
Mhm.
CFO has a great line for us as we go through kind of our pitches. And he said, it takes, 1,000 yeses, but one no. Well, you got to identify the no up front, right? So is it,
Mhm.
in the finance world? Is it in the clinical world? Is it in the marketing and sales P&L world? And you want to get them in early, right? I think selling into the blues, I actually just spoke at a conference last week, and my kind of plea was I think typically, right, you got to make sure you're not always trying to hit a home run.
Mm.
And like this notion of putting up singles and doubles is a really good idea to win, especially in today's environment. So as you look across all of the reported earnings, there is a massive Medicare Advantage headwind, right? It is cost pressure for
Yeah.
all the payers, which means solutions that are generating kind of tangible cost savings in theory, right, should
Mhm.
be adopted. But I think it goes back to but make sure you're not coming in, with this unbelievable, I'm going to solve all your 1 year problems from a cost basis. That breeds skepticism.
Yeah.
The other thing I think is a real watch item is make sure you understand attribution, because for the past at least 10 or 12 years, especially in the government lines of business, there's been an attribution play, right? Delegated provider risk, delegated specialty benefit carve out risk. And if you're then
Mhm.
going back to maybe one of those no's, like a CFO, right? A CFO and the actuary team have to figure out, well, wait a minute, what program's impacting that member, right? So you really
Yeah.
want to understand, okay, who am I impacting? What's my cohort? And then how do I measure it? And am I measurable? So those are a couple, I think, key pieces. The other thing I would just note is, given those kind of headwinds that are, you know, arguably some of the strongest we've seen right now, is what's your implementation plan? Don't go through and pitch the deal, right, and then say, oh, but wait, here's how hard it is to implement. These are, especially the Medicare Advantage lines of business, a lot of legacy claim systems that still exist. And they exist because they work. They're just old managed care claims processing systems. So you got to look at that and
Yep.
say, what's my implementation plan? Like, do an implementation playbook, have that like as a early deliverable. So you just get aligned on timelines, because you might get to that yes, and then, oh, but we're going to implement 9, 12, 15 months later. And you want to know that up front, just so you're setting expectations back with your own team. That's I've been there, done that.
Complete.
It's on both
And your
sides.
investors.
Well, and your investors. So
Yeah, yeah, and
absolutely
your
got to be
investors.
transparent.
Yeah. I think that's so important. It's something that I think is a huge gap across the board, not just saying selling in, payers, but really selling into anywhere
Yeah.
is, there's kind of like the sale happens, but then there's very little ROI from that purchaser, because there isn't like a true adoption plan or a marketing plan to drive adoption once somebody says yes to it.
Yep.
And so they've got a real small adoption, and they're just not seeing the ROI. So then it never then gets scaled across the broader organization, and they just don't see the return that they had hoped for. And there's so many nuances with that, of people leaving and priorities changing, and how do you have contingencies for all of that?
Well, I mean, there are so many changes in kind of leadership roles right now. It's kind of unprecedented in especially the payer
Yep.
landscape, and a
Yep.
lot of that's just kind of the retirement cycles hitting differently, but then performance issues and all that. That's why I go back to like that notion of like team sport, right? Your
Mm-hmm.
executive sponsor, you've got to be aligned on your objectives. And as a buyer, I was never a fan of like, hey, I'm going to buy and then turn around and then you're going to be successful. Those typically don't work.
Right.
And
Exactly.
honestly, what you run into is, well, wait, what you promised doesn't meet the SLAs, and now you're in breach. Versus saying, hey, like, we got to collaborate on network, right? So
Yep.
a good example for us is we're fully delegated for network, so we go contract the network. Well, I'm not going to do that blindly without talking to the payer, right? So use a
Sure.
blue plan, hyper local, right? Who's your important
Mhm.
local and regionals, right? Then you get to the nationals. What are your most important scaled relationships? So you really got to, I think you got, I hate to use the word bespoke because then people can like, oh my God, I can't do custom implementations, but it's like almost a bespoke implementation model. Like, who's my sponsor? Who am I working
Sure.
with? And how are we making sure we're synced up on objectives? Like, you want a good buyer, and that buyer has got to put their sweat equity in as well to generate the ROI. So I'm a full kind of be transparent, pitch it as a team sport. All stakeholders got to collaborate. And then at the end of the day, why are you doing it? All these solutions, doesn't matter, all the folks you've had on, right? Helping members, right? We got to keep like
Yeah.
we got to have mission orientation.
Sure. So, before we move from that topic, let's just talk about like piloting, because I know a lot of people in the audience are trying to pilot with those organizations. What has been your experience, or insights around the appetite for paid pilots? And what does something like that look like, in order to be successful to expand into some kind of paid customer relationship?
Yeah, great question. I'm gonna keep my old hat on for a second.
Mm-hmm.
We and I'll give IBC's great even today. I think it's a plan that had a lot of density and has a lot of density within like the Philadelphia area. So
Yep.
pilots work. What you have
Mm-hmm.
to be able to do for pilots is you have to be able to measure, right? And if you can make sure you get the data agreement correct first, it
Yep.
allows, once you do the proof point on pilot, to then scale, right? So if you miss that critical step, the pilot kind of has a nebulous like, hey, I have these metrics that we're all going to kind of go debate, did they work or not? So regardless if it's a pilot or full rollout, like set success
Yep.
metrics and make sure you can measure it. I think the other thing is it really depends on the type of solution. I think
Mhm.
sometimes innovators, entrepreneurs look in and say, "Oh, well, I just need a large customer to pilot on, or I need, can I take your polychronic Medicare members?" What's really hard sometimes to segment that out, right? The business lines that are insurer are Medicare, dual eligible patients, Medicaid, commercial risk, where the payer takes full
Yeah.
risk, commercial
Yep.
self-insured,
Yep.
ACA. So I think my past experience says there's also not a really deep understanding sometimes, especially like early stage entrepreneurs, on what are the regulatory environment and what are the hurdles you have to. So you have federal, but also state. So know the state you're working in. So, I had a
Mhm.
business that ran the blue brand in Philadelphia and an unbranded business called AmeriHealth, a very successful insurance company. But two different legislators. I had the Pennsylvania Insurance Department and Dobie. They're
Right.
totally different. Like, to get something approved in New Jersey is totally different than Pennsylvania, even if it's the same program. Doesn't mean you can't do it,
Sure.
but like understand
Right.
that environment. So I don't know that they always have to hire, kind of entrepreneurs and kind of innovative solutions, but you should have someone, that owns that either through kind of a outsourced, like, hey, let me figure out, why is Texas different than Massachusetts than California. I would say that's somewhat of the biggest failure point, is saying, hey, it looks
Mhm.
really great on paper. I know you just want 50,000 members or 20,000 members. I can't carve them out because if it's a federally sponsored program, I
Yep.
can't disadvantage a member, right? I got to get a CMI innovation grant or all that. So I think that the understanding that is really key.
Sure. Yeah, that makes sense. Um, and really, it takes, in my mind, it takes a lot of research or expert guidance to be able to navigate that, because it's very rare that someone's going to understand all of the different state regulations to be able to say, I'm going to go to market in this state for these
Totally.
reasons, right?
Re-
Without
re-
doing that kind of homework.
really highlights another way to get at that is, what have you done on the board from a governance and advisor standpoint?
Yeah.
I
Yeah.
have been blown away by the support that I get from my board and board advisors. And we built
Mhm.
a purpose built board for that.
Yep.
So we know we have an expert in managed care, someone who ran P&Ls, an expert in network, a payer CFO. So if you're selling to payers, you got to have payer expertise on your board. You just,
Yeah.
it's
Right.
great to
Right.
have all the experienced innovators and entrepreneurs and, investment professionals, but you need domain expertise and industry expertise. And I think that's overlooked sometimes as
Sure.
well.
Yeah. Yeah. That makes sense. I worked with a client not that long ago who was really successful in Spain, and they wanted to enter into the U.S. market, and they were selling to seniors. And so we looked at all of the different Medicare Advantage plans across the country, and we did such in-depth market analysis that we were able to, they had English speaking offer, but a Spanish speaking offer. And so it was really clear that their positioning and value proposition needed to be around that Hispanic population,
Yeah.
and that dual eligibility. And so we were able to identify a population, the very narrow set of payers in that area, and they landed a payer contract within 60 days.
That's amazing. I mean, that's great, but that's the market, right? So, I mean,
Right.
if you, so
Yeah.
when I was running our Medicare business, we would always kind of like gamify it, right? So you're
Yep.
68-year-old senior, maybe just retired, you didn't buy Medicare at 65, you're getting it at 68. Like, go
Yep.
shop online. And then you're
Mhm.
85 and then have the broker's pitch. I mean, it's like 64 options for a seat. Like, I grew up in health insurance, and I would
Yeah.
look at it and I'm like, I honestly have to go call my team to sit with me like, I would not be able to buy this. Like, I've got
Right.
my mom
Right.
and dad. I'm like, yeah, by the way, I'm gonna have someone on my team call you. Yeah, I run the business, but like, whoa, because it's so nuanced.
But I
So,
don't know.
but you're right. Like, you got to start that bottoms up. I
Mhm.
love that. That's a great. I mean, that's a
Yeah.
perfect
Yeah.
example of how to do the research.
Sure. So let's talk about Tango Healthcare. So where are you in the commercialization journey now?
So we are now expanding outside of the Southwest. So we spent, about the last 12 to 18 months building a great executive management team. So we have a CFO, and I tell everybody this. In some ways, I guess I'll kind of break the story here a little bit. I was very purposeful the way I built the management team. My CFO's in Nashville, Chief Growth Officer is Detroit, Chief Strategy Officer is Seattle, CIO is in Dallas, COO, Head of HR, Compliance are all in Phoenix. I'm in Philly.
Yep.
My client services is in Philly. Like, it's great. I spread this national team out. The reality is that's where
Hmm.
the best people were. But I like kind of tell a little white lie to be like, look at that, I set it up regionally in this remote world. But we built a great team over the last 12 to 18 months. And then we really spend time building our kind of core infrastructure and technology so that we can enable value-based payments. We pay providers prospectively. So we're a utilization assurance company. So we kind of take a different angle on Like, I'm not trying to prevent services. I'm trying to get more people into the home. And now we're really poised with significant state expansion later this year. We'll be entering in 5 new states before year end, and then about 6 to 8 within the first 2 quarters of next year. So really a national expansion, both with national payers. And then we've actually put a lot of emphasis on the regional plans, large regionals and blues, just knowing the
Hmm.
cost pressure. And our strategy is really land and expand. So Arizona is a great example. We service basically every payer in Arizona because we're independent, right? So we're not,
Yep.
we're kind of sit in a very, I think, optimal space, right? So we're,
Hmm.
not steering. We are matching to the best providers, and our national network is second to none. It's all value based, and then we really go into each market and we make sure great regionals, great locals who typically cannot get a value based deal we put them on our platform. We show them how to get earns for reductions in readmits and ED. So we're real excited about the growth. We should kind of double the company over the next 12 months.
Nice. So how unique and different is what you're doing compared to what's available in the market?
Yeah, I mean, obviously, I'm going to be biased here, and I'm saying no one else is doing it. We just recently announced a
That's what
partnership
they
with.
all
Yeah,
say.
I mean, right? Yeah, I think
I mean,
the
yes,
proof's in the
nobody else
model.
is doing
Nobody
it.
else does it. We just signed a partnership with a company called WellSky, one of the leading post-acute technology company in the country. So now we're able to do home health, which is our core. And now we go into
Mhm.
SNF, IRF, and LTAC, so skilled nursing facility,
Yep.
inpatient rehab. We manage transitions, and we take risk across that whole episode. So that's first of its kind. It's technology powered with some of the great WellSky assets and the Tango assets.
Yep.
So now what that allows us to do is, home health, in the relative scheme of dollars is small, like $25 to
Hmm.
$30, per member per month. Think of an MA
Yep.
premium being $1,000. So it's a, small but impactful.
Mm.
Well, now all of a sudden we're able to go to $100 PMPM. Now we're making real impact, and our primary
Mhm.
objective is, we all have, parents, grandparents, seniors, whatever. Where do they want to
Yeah.
recover? They want to recover at home. So our model is
Yep.
get you home to recover at home. So the other differentiation we do is, since we go up kind of at discharge, we grab that referral. We're actually managing the placement of the patient. So we still, patient choice exists. So if you have a good reputation and relationship with a home health provider, we do that.
Mm.
But we
Mhm.
actually look at, what are you discharged with, right? A 68-year-old hip replacement patient is much different than an 85-year-old polychronic hip replacement patient. So we're going to match Acuity,
Sure.
and we're going to do a provider match, where our competition is not doing that today. They're not grabbing the referral and doing the match, and they don't have the partnership that we have with WellSky to go comprehensive. So we think that's great differentiators for us.
And it does. I mean, it seems like just a slight nuance that maybe shouldn't make that big of a difference, but in reality, it makes a huge difference in the care that people are receiving.
It does, right? So, understanding, like I call it, disposition of discharge, right? Understanding
Hmm.
that is, I think, really important, because then you're managing to that, right? I mean, someone doesn't, but I don't care if you're, 45, 65, or 85, right? When you get home, you want to stay home. You're not looking to go back into the hospital, right? But what happens if
Right.
the visit's
That's the
on a
last thing
Monday?
you
Yeah,
want.
you're just like, no way. But if the first visit's Monday and the second visit's Thursday, and that's might be appropriate, but what happens Tuesday and Wednesday, right? Anxiety goes through the roof,
Yeah.
right? Maybe you're
Yeah.
having a coordination with a DME service you don't have, or something like that. Well, that's where Tango steps in. So we're like a bridge also with our care management team,
Hmm.
and we're able to say,
Yep.
hey, look, we have to get someone in to see you Wednesday. You can't wait till Thursday. Or, hey, let's facilitate a telehealth visit. Or, wait, you need transportation to get back to the primary care office. Oh, actually, your payer
Hmm.
covers that. Let us coordinate that for you. So I think, in some ways, it's as easy as kind of like communicating more, and kind of like putting a bubble wrap or around the patient. Like, we're gonna be there for you. And I think it's compassion and empathy as well, right? So we try to be really cognizant of that.
Great. So I read something about a listening tour and co-creation or co-designing solutions. So let's talk about that a little bit. Where did this? It's something that I talk a lot about on the show, and but I don't hear many guests talking about it. So when you think about, you know, co-creating this solution, where did you get that idea, and how has that made a difference for the company?
So I've maybe like everybody back in kind of 10, 11, 2010, 2011, Steve Jobs passed away, right? And I don't care what
Yeah.
business you were in, we were all obsessed with innovation. We were like, oh, we got to innovate. We got to
Mhm.
innovate. We lost the greatest innovator, right? So we did the same thing in IBC. We launched an innovation practice, and it was highly, highly successful. We brought in actually a consultancy company. They were called What If. I'll give them a shout out. And they
Mm.
brought in this really unique way to do co-design. And it was like, people didn't know a lot about healthcare, but the graphic walls, right, the listening and all that, and what words
Yeah.
popped. And what it allowed us to do really is we had this thing like a rope they did, right? And they're like, what's in scope, what's out of scope, right? And typically when you say something's
Mm-hmm.
out of scope, you don't pay attention to it. Well, the reality is like we were too inside, right? So like a
Yeah.
lot became out of scope. And it's like, well, why is that out of scope? That's not out of scope for the patient, or that's not out of scope for the doctor, right? So I had this great
Mm-hmm.
experience, when we launched the innovation team, and it's still a great department at IBC now. So when I got to Tango, it was like, all right, how do we innovate kind of the business model? Well, we used to provide care, but we're not providing a lot of care anymore. And by the way, we provided
Right.
care in Arizona. We didn't provide care, in other states, and we got into Nevada and stuff and said, well, why don't we go to where the care is being provided? Like, so let's talk to our provider partners. Like, let's actually go, okay, what's your challenge when you get
I
to the
have a
first visit?
concept.
Yeah, like what is the first visit? What's the most thing? Well, oxygen's not there.
Yeah.
It's like, oh well, yeah, DME coordination. You can't care for the patient if they don't have their DME supplies. Or, hey, by the way, I spend a lot of extra time making sure the patient doesn't go back to the hospital, and I'm not compensated for that. I don't, the call that
Mm.
happens. And by the way, when that nurse leaves the house, I was like, all right, what's the most important thing? It's not writing up everything that happened. They're trying to get to the next visit. Why? Because there's a staffing crisis in home health, right? So I think
Yeah.
that ability for us to not assume we knew the answer was just massive, right? So we did it provider side because we are a provider enablement platform. Our customers, the
Yeah.
payer, but I have a great team of all ex-payer folks. We understand the payer risk model, et cetera. We had to kind of flip it on its head and say, well, what does our delivery model need? And I think it's
Mm-hmm.
resonated with the providers because we're listening to that point,
Yeah.
and I think that's why we've kind of gone down that path.
I mean, so what have you learned that maybe debunked some of your assumptions, or not yours, but maybe your team's assumptions? Is there anything that you learned in that listening journey or co-design that really has been pivotal to the success of the company?
Yeah, I learned something really somewhat shocking to me. Being a long time managed care person, right, and touting
Mhm.
the virtues of managed care forever, I was stunned to find out that traditional Medicare pays home health providers more, and it's much easier to get approved than Medicare Advantage. Yet, what just happened in
Wow.
2024 is there are now more Medicare Advantage enrollees than traditional Medicare.
Hmm.
Well, now flip that to the
Mm.
delivery side. When we talk to them, they're like, well, I got to grab most of my capacity through traditional Medicare so I can pay the bills. I don't have a lot of capacity for
Mm.
MA because post COVID,
Mm.
nurses have left the workforce in kind of droves, right?
Sure.
So I think that is a huge like aha moment for me because when I came in here, I'm like, oh, managed care, it's great, right? Well, there's hurdles and there's staffing hurdles and reimbursement hurdles. So then collectively what we learned is, well, wait a minute, can we make the business model look like Medicare? Because these providers are providing the same level of care. They're not looking at the card when the nurse gets to them. They're not like, oh, it's a managed care patient, I'm
Right.
going to treat this patient differently. No. So we said, well, let's treat it like pay them prospectively, like pay them for the episode up
Hmm.
front so they can say, hey, you figure out the
Yeah.
visits, right? I'm not going to tell you to do 10 visits and 2 calls, right? If it needs to be 12 visits, like, it, you're getting like, you
Mm-hmm.
should maximize those dollars. So that was a huge learning for us. And look, we're not we are not pencils down. I mean, this is going to evolve quarter by quarter, month by month with our partners as we roll out. But what I hope they realize both on the payer and provider side is, we're a partner, right? So we want to be a team
Yeah.
sport. Like we're maybe the point guard, but like, we're going to let the shooting guard shoot. So that's kind of what we're after.
Well, one of the things that, like, to me, what you're describing is a game changer in whether you're going to have commercial success or not. I mean, can you be successful without it? Yes, but you definitely stack the odds in your favor when you're co-creating your solutions. In my mind, it's not something that you do one time and say, okay, we did the listening tour and
Yep.
it's done, and now we're going back to, just implementation and driving sales and marketing. But in my mind, the inexperience is that those organizations that embed that in the fabric of the culture and the DNA, and this is just what we do day in and day out with these feedback loops, you're able to anticipate customers' new needs or shifting needs. You're able to innovate faster than the competition and deliver better value, new value that competitors aren't. And it's a strategy for success all the way.
Yeah.
And you don't stop until you close the company down.
I couldn't agree more. Look, I'm a very average golfer, right? But I golf a lot because my 13-year-old son is addicted, and I watch him get better and better every day. Well, he's not, if he hits a bad shot, right? He's like, oh, what did I do wrong? How do I improve it? He's not going to just keep hitting that bad shot, right? So I think it's the same way. It's like,
Yeah.
what do you do in life? What do you do to get, be a better human? Like, hopefully you're working on yourself every day. It's the same thing in business. I think if you think you have it figured out on a Monday, and change comes in on Friday, you don't react to it. Those are the businesses that don't survive. They're not indelible.
Sure.
They don't have that kind of value prop that someone says, I want to continue to do business with you. So Tango, we want to be great partners. We're going to be great listeners. We're not always going to agree, right? I mean, we're going to say, hey, that maybe that doesn't work. Here's why, but we're going to have open, transparent conversation about it.
Sure. So, how has partnerships as a strategy also played a part in Tango's success?
Extremely positive on the provider side, because I think what providers are realizing is it's going to be really hard to get 6, 7, 8 different flavors of a value-based contract within a market, because there's not one dominant. Like, even if you're the most dominant payer, right? You're 30 to 50% market share. You still have to go to payer 2, 3, 4, 5. So really positive there.
Yeah.
On the payer side, as I kind of joked earlier, right? Selling the payers is hard, right? So what we are trying to,
You're looking in the mirror,
and I
right?
am, and I tell my investors, I was like, I too was a bad payer. I think I was good, but I must not have been. I just put them through the ringer.
I love it.
So yeah, I'm like Stuart Smalley every day. I too was a bad payer. But I think what we're looking at, and I will say, we try to pick good partners too. We will not pursue business opportunities if we're not aligned on generating access and value. So if it's someone that wants to cut visits and drive down costs because they have a huge MLR hurdle, we're not the right solution. If it's someone who makes to make sure that we're going to look at a total cost of care reduction and we're going to get your seniors or your duals or your CADE members better, we're going to be a great partner. So it's really making sure that our buyer, right, believes in total cost of care and value. And that goes back to maybe your early question, like, where are we on the journey? Like, we're a third through the book, right? So not everyone's there. And I think, unfortunately, these headwinds, I mentioned earlier, I'm in Philadelphia right now. So I'm born and raised here. I'm a diehard Philadelphia Phillies fan. We all thought we were going to win the World Series last year. Why? Because in the first 2 games, we're up 2-0. We hit all of these home runs in a National League Championship Series. Game 3 comes around. We stopped hitting home runs, but we didn't hit singles or doubles, right? So we chased home runs, so we lost, right? And I think that's a little bit of the payer dynamic with a few folks saying the headwind's so big, right? Hey, you're not a home run, Tango. You're right. I'm a great double. But if there's a man on base and I hit a double, I'm going to drive a run in. So we're trying to make sure we get those buyers kind of oriented. And then, maybe the next chapter will be the non-believers will come over to what we're selling.
Sure. Yeah.
Hopefully.
So as we wrap up here, what else would you want to share with our audience?
I think just that we're excited for partnerships too. So, if I think about post-acute, I mentioned WellSky and kind of we have that, which allows us to go broader, but we're not done there. So we really are looking as broad as we can of who can be good kind of enablers with us. We don't believe we have to do everything ourselves. We want to, we're a great brand, I think, to also pull other people into the home and make the home a more appropriate setting of care. I think that's another complete innovation track. I mean, you could probably do a series just on what's the home going to be over the next 5 to 10 years. So we're excited for that. And then just, kind of reach out. Like, if you're a payer listening, we want to make an impact in your market. So we're excited for where we're at.
Awesome. Well, thank you so much for joining me, Brian. Appreciate your time today.
Thank you so much for having me. It was a lot of fun.
Awesome. How do folks get a hold of you if they want to become a partner?
Yes, tangocare.com. So I can be reached at BLOBLEY, B Lobley at tangocare.com. Thank you.
Awesome. Thank you so much for listening. See you on the next episode of Health Innovators.